Hello friends, today we will be talking about a very important topic which has not been well discussed in literature, that is sleep and fertility. All our discussion will be based on the systematic review, the impact of sleep on male and female reproductive functions, which has been published in Fertility Sterility, and our discussion will be based on this French study. What is the effect of sleep on our health? Sleep quality and quantity has effect on all functions of our body, be it immunological, cardiovascular, reproductive, and metabolic. Poor sleep is associated with cardiovascular risk, cancer, diabetes, and obesity. Poor sleep not only affects our health in that way, it affects our mood and it affects our thinking. That is, you must have seen that people who do a lot of night duties or do a lot of night shifts, they're very irritable and they have mood disorders. So, why we are talking about sleep and reproduction is because the hormones that are related to sleep, that is melatonin, its receptors are present in all the reproductive organs also. So, melatonin is related to sleep as well as reproduction. And sleep and reproduction are very less well studied topics, but sleep is related to reproductive cycles also. And so, disturbed sleep affects reproduction just like it affects our health. What parameters have been discussed in this study is the effect of sleep on semen parameters, on ovarian function, on time to pregnancy, and on IVF outcomes. So, if you look at this chart, it says that people who have irregular night shift duties or who have short sleep or always remain in a sleep debt have difficulty in their reproductive organs, which is connected to the brain. That is, it affects the HPO axis through the melatonin and then it affects the reproductive function, both the ovarian as well as the sperm cycles. As well as there is something called a chronotype. So, what is a chronotype? Chronotype is that there are a set of people who wake up early in the morning and sleep early. Then there are a set of people who wake up late and keep on awake till very late. So, these chronotypes, people who wake up late and they sleep very late, are the ones whose reproductive function is also affected. So, what are the effects of sleep on patients? Patients who do not take enough sleep, that is, at least 6 to 8 hours of sleep, they have irregular periods, they have disturbed mood, which affects their reproductive function, they have chronic diseases, which lead to poor health, and their semen parameters, specifically their motility, is reduced. So, what is our duty? Our duty as healthcare professionals is to motivate our patients. If they are fighting with infertility, they should not do night shift duties. They should only work during day. They should get up early in the morning and sleep early in the night. And they should not live in a sleep debt. So, if they remain in sleep debt, they will have problems. So, sleep hygiene is very important. What is sleep hygiene? Taking proper sleep and sleep empowerment. This will reduce the time to pregnancy. Thank you.